tech revolution in eye care has been going on for at least the last few decades, right? You know, an optometric office from 40 years ago is almost unrecognizable these days because it's been so completely transformed. In the beginning, of course, people used to they'd upgrade their technology in kind of a piecemeal way, where, you know, they'd buy one unit from one company, they might have a different, an autorefractor from another, and the pieces never really spoke to each other too well. These days, of course, one of the big advantages of modern systems is a higher level of integration. And this is what I think tonight's lecture is all about, talking about how modern systems work well together to improve efficiencies in your office. And fortunately for us, we have an expert tonight, Dr. Jeffry Gerson from Grin Eye Care in Olathe, Kansas. So you probably have heard of Dr. Gerson's work before because he writes a ton in review and in optometric management. You've seen him certainly at ODwire and CEwire. And you know, he also participates in a lot of industry panels. So sometimes he gets sort of sneak peeks and behind the scenes looks at up and coming technology. So he's gotten to evaluate a lot. So it's really great to have him here tonight to walk us through this and how he is using technology in his office in the most modern way to streamline his practice. So Jeff, thank you so much for being here tonight.
Yeah, Adam, thank you. Thank you for the introduction. And, you know, I agree with everything wholeheartedly that you said as far as technology, and that the optometric practice of today doesn't look anything like the practice of just a few decades ago. And the thing that you mentioned that I'll point out is, you know, the difference of upgrading piecemeal, kind of like you said, oftentimes happens, versus doing it in, I guess, a more thoughtful manner where you're getting different instruments that all talk to each other and to really, really optimize your efficiencies. And I think you know, in this, it's a long title here, but to me, the most important word is efficiencies. How can you do things in a way that's better than what you've been doing before? Efficiency doesn't necessarily mean faster. To me, efficiency means doing something in a way that's better. Usually it is faster, but it's faster, at least in this case, it's faster with better quality. And so that's truly creating efficiencies. So let's go ahead and jump in and get started. Let's see, there we go. All right, so let's talk about what I'd like to accomplish. Obviously, first, I'll introduce myself, my practice setting, talk to you about optimizing workflow by integrating new upgraded technologies, and enhancing the patient experience with multimodal screening technologies. And then finally, talk about some of the key benefits of optimizing my practice with new technology. So, you know, I'm not here to talk to you about something that's out there. I'm here to talk to you about something that I use in my practice every day when I'm in the office. And so it's something that I have real world practical experience with that I think is really important whenever we're talking about something. And then obviously the last thing I want to do is have a question and answer session and really hear the questions that you have on your minds and be able to give you the answers, at least that I have, from my perspective as someone using the technologies that I'll be talking about. All right, so Adam already did an introduction, but you know, I've been practicing for over 20 years and seen a lot of different technologies come and go. A lot of times I'm pretty quick to jump on, sometimes not quick enough to jump off, but usually pretty quick to jump on to new technologies and try to take advantage of them, because I think it's a way to really enhance the care that we're able to provide for our patients. Grin Eye Care, where I've been practicing for the last 7 years. Actually, I got a message from my office manager today that today was my work anniversary. Random day. But we're a pretty busy ODMD practice that focuses on primary care. So we're not really a tertiary care center. We're seeing patients just like you do. Patients that come in to get their eyes checked, that need new glasses, and taking care of all the same basic needs that you're taking care of for your patients as well. So we're a pretty busy practice where it's really important that we're efficient. And one of the places that a lot of us lose efficiency is in refractions. That, you know, sometimes we'll look back and say, how did it take X number of minutes or that long to refract that patient? And so it's really important, really, for all of us to not just be good at refraction and give our patients the right prescriptions, but to be able to do it in an efficient way that we're able to continue moving with each patient and on to the next one. Again, to me, efficiency means doing things not just more quickly, but also more accurately. It has to be both. Because if you just become quicker at something, but the output is garbage, then what good is it? And the flip side of that is if you're doing a fantastic job, but you're only able to see 4 patients a day because of how much time you're spending, that's not a great situation either. So we need to address both. In our practice, our techs are enabled to go, not just do autorefractions, but to confirm autorefractions, do refractions, and really help us, again, with our efficiency. And because of that, because a lot of times techs are starting refractions, it's really important that our autorefractors do a really, really good job. So that it makes it a whole lot easier to confirm or do a refraction when you have a great starting point. And so for me, refractions start with the autorefraction done in the pretest area. So we'll talk about that. Now, one of the things that I would tell you is I know that I spend less time refracting than I used to, which gives me more time to be able to just sit back and chat, talk with my patients, review the exam findings, discuss options for them. And the reason for that is, again, I keep using this word because my refractions, especially when I'm doing using our digital phoropter, have become so much more efficient. For me, adapting to using a digital phoropter has been really rewarding because of that ability to be able to spend more time just talking with my patients. That's something that I think a lot of us feel like we lose out on. We don't have time to just talk. And our patients oftentimes feel like they don't have time to just talk to their doctor. But when refractions take less time and I'm more confident that I'm getting great end results, I have more of that time to be able to sit back and chat with my patients. So what am I doing to optimize the workflow? And how am I doing this using technologies that are integrated together? So let's talk about that. So it starts when one of my technicians runs the Visionix VX40 lens analyzer. It is a digital lensometer that, really you just set the frames in, press one button, and then everything is read. So prescription, PD, it shows a profile of the progressive lens, it reads prism, it does everything that you need to be able to do in an accurate way, and it then integrates into your EHR. So after that's done, or while that's being done, our patient sits in front of a Visionix VX130, which is it's actually not even close to accurate to call it an autorefractor, and you'll understand why here in just a minute. I think a more accurate description would be an anterior segment analyzer, and you'll understand why I say that. And so in 90 seconds, we gather a whole lot of information. I'll share with you what I mean by a whole lot, that again integrates into our EHR. And then in the exam room, I'm using our Visionix VX65, the digital phoropter, to do the refraction, which is quicker, easier, more laid back and relaxing. And I'll tell you what I mean by that. To do my refraction. And then with just a press of a button, I'm able to show you one button, here's your glasses. Next button, here's what we found today. What do you think? It makes it really easy to show my patients how much better they'll be seeing with their new refraction that I did with the digital phoropter. And by the way, patients are incredibly impressed with a digital phoropter because for most of them, it's something they've never seen before. If you've never seen one, there it is over my right shoulder. I'm in one of our exam rooms doing this talk for you right now. So again, how does all this data integration work? Well, all the different instruments go into your EHR. So everything is just in one spot. Everything is right there. So when you're sitting in your exam room, you have access to the information that was gathered in the other rooms. And so it makes it, again, very easy to be very, very efficient with our time. And patients really like this. So the data uploads directly from the VX40 and the VX130. So the VX40 is the lens analyzer. The 130 is the anterior segment analyzer, goes into our EHR. So it's all put into one place. We can then export it to the digital refractor, so I can make my starting point either the autorefraction that the analyzer did, the anterior segment analyzer did. I can make my starting point the patient's current pair of glasses, or I could choose something else if I wanted to. What I know, excuse me, is that I get consistent measurements to start from, regardless of who it is operating the instruments before I see my patient. No matter who it is that's using the anterior segment analyzer, I know that I get very accurate, very consistent data every single time. And this is great because in the office, you know, when I'm seeing patients tomorrow morning, there'll be 3 different technicians. I don't have to wonder, well, gosh, I wonder who captured this data. It doesn't matter. I know that the instrument did it, and I know it does a great job every time. I don't need to put any second thoughts into it. Because this all integrates, it allows for improved documentation as far as accuracy and what is documented, because it can be fed straight in from the instruments into your EHR. All this adds to enhanced patient experience, because when you have everything in one place, you know, how often do your patients ask you, well, doc, how much did the new prescription change from the old one? And what we're used to saying is, oh, not very much. Well, now what I can do is, you know what, let me show you. Click, there's your old. Click, here's your new. Can you see a difference? And it makes it very, very easy to make this a better experience for our patients. Obviously, it also improves workflow, because anytime you make anything easier, it makes it, well, easier. And it makes your day go by easier, and it just makes it more fun. You know, this is really one of the things that in the last few years has really changed the way that I'm able to practice and really make things a lot easier for me without any compromise to the quality of care. As a matter of fact, I think it improves the quality of care. All these instruments have a pretty small footprint. Digital phoropter, obviously, it fits on an arm on a stand in your room, just like any other phoropter. The lens analyzer takes up no more space than a traditional lensometer. And the anterior segment analyzer, again, basically the same size as any autorefractor. However, it does way more than the average autorefractor could ever think to do. So here is the Visionix VX40 lens analyzer. So one-click lens analysis. It gives us consistent, repeatable readings. Again, regardless who measures the glasses. I could have my 17-year-old come in here. I could have my 11-year-old come in here. And all I have to do is say, here's how you put a pair of glasses on this, and then press this button. That's it. So it is incredibly easy to use. It accurately measures prism, which I think is a really big deal. It's amazing how many times someone comes in to interview as an optician and they have no idea how to read prism. I would tell you that using an automated lensometer like this, you may think of it as a minor, but I would tell you it is a very meaningful improvement to your patient flow and how it works. I'll show you how I have mine set up and how it's used on a regular basis, and be able to explain to you how it really, really helps my technicians to be more efficient. This is another one of the things that when patients see it, it is a huge wow factor, because the lenses move, right? It analyzes one lens, then it moves over to the other lens, it analyzes that, and all of a sudden it pops up on the screen, and patients are wowed by this every day. So this is really the wow factor of what patients see. One of the other things is this shows, and you can kind of see it on the screen there, it shows the progressive lens design. And so we've had instances where glasses are made to the right prescription, but we're able to show a patient the, I guess, topography or design of their progressive and how that's the problem. It's not the prescription, it's the lens design. And it's the cheap lenses that you got instead of getting them from us that may be the problem. And it really helps to keep some of our patients in-house as far as optical. So here is the screen that I look at once we've done our anterior segment evaluation. On top, we have autorefraction in both photopic and mesopic conditions. So simulating what it's like to have your night vision when you have slightly larger pupils. So sometimes we're able to show patients, like in this case, that, wow, look at that. You have a 3/4 diopter or a half diopter difference in your prescription at night. That's why I have a harder time seeing at night. Maybe you ought to have a pair of nighttime driving glasses. We can see the K readings. We can see the topographical map. We have central corneal thickness, so we have pachymetry. We have IOP measurements, and we have adjusted or corrected IOP measurements based on the central corneal thickness. So all this with one press of a button. And so less than about a minute and a half to gather all this information with one press of a button for your technician. It's fantastic. Techs like it because of how easy it is and how all this on one instrument. What I would tell you is important to me as a doctor is the information is incredibly accurate and consistent. My refractions are so much quicker now because the autorefraction is so good. What really impresses me is how well it works with my high cylinder patients, and that I rarely have to change axis by more than just maybe a couple degrees. It really does an overall excellent job of visual assessment. Gives us 26 different diagnostic measurements in approximately 90 seconds. This is just some of them. There are more. There are quite a few more corneal measurements that it does. It's amazing how much data is gathered in such a short period of time. In our practice with the ophthalmologist, we were looking at getting a pentacam for purposes of doing refractive surgery and for doing refractive lens exchanges, LASIK, all those kinds of procedures. As it turns out, we got this instead because it does all the things essentially that a pentacam does or other similar instruments, but way more. And so it's something that's not just a specialized instrument to use on our refractive surgery patients, but it's something we use on all of our patients. So some other things that it does that are helpful for patient education. It shows a simulation of what their vision looks like uncorrected versus corrected. It shows us what the lower order aberrations do to our vision. It shows how we can correct that with proper prescription. It shows what we do with that in regards to refractive error. So it just gives so much information that we can distill down and show to our patients. It's pretty easy to show our patient, hey, look at these images on the left. That's how you see things without your glasses or contacts. And look at the one on the right. Look how clear that chart is. Look at the pinpoint of light on the bottom right there that looks like a pinpoint of light. Whereas on the left graphs, you can't even tell it's a pinpoint of light. It's so out of focus. So all these things are things that we can demonstrate to our patients that we're able to show them that makes our job easier. Another thing that's important in today's world is the logistics of doing a refraction. And so I can sit 4, 5, 6 feet away easily. I could sit 10 feet away or more if I wanted when I'm refracting my patients because I'm not reaching up and have to do anything with the phoropter. I'm doing all my refracting with my tablet. And so I can be sitting with my tablet as close as I want or as far away as I want from my patient. I can be 6 feet away quite easily. So it's quite easy to be socially distanced, which is something that's obviously good for us, but it's something that's important to a lot of my patients as well, that they like that they don't have somebody in their face when they're doing something. And ergonomically, it's much easier. You don't have the same reaching up and strain on your shoulders. It's so much easier and so much more comfortable for me to be able to do it. It's actually kind of fun. The other thing I'll tell you is that patients are incredibly impressed, and it really changes their perception of the practice. Every other eye doctor they've gone to since they were kids, since they can remember, is using the same thing, which is better, 1 or 2, and click, click, click. And this is something totally different. It's something that most of them have never, ever seen. And I'll show you some examples of some of our Google reviews where people are really impressed with technology. It makes it really comfortable because instead of reaching up and wear and tear on your shoulders, again, it's just in my hand. I've got my tablet and I'm refracting from the tablet right here. So it just makes it so much easier and more comfortable. Less shoulder and back pain at the end of the day, at the end of the week. Very, very easy. The chart that we use, it's a very flexible visual acuity chart. And what do I mean by flexible? Just like any other digital chart, it's probably not all that different. But again, linked up to the tablet. So I'm changing the chart from the same tablet that I'm doing my refraction from. So I'm able to do both at once. It's not 2 different controls or 2 different places. Obviously, we can show multiple lines, 1 line at a time, vertical, horizontal, 1 letter at a time. It offers different languages that it has the letters in. It has different contrast levels. It has ETDRS chart. I could go on and on and on all the options of the chart. So, but I think the most important thing is that it's integrated into the same tablet that I'm doing my refraction from. So when I'm doing my refraction, what does my tablet look like? Well, I can choose to have it look like either the one on the left or the one on the right. The one on the left is trying to really simulate a traditional phoropter where it's green, you just drag on it. So we drag the dial up or down for a quarter diopter, or where it's blue, you just tap on it to make changes. So it makes it very, very easy, very intuitive. The one on the right is a little bit different. And when I was first shown this kind of as a prototype, I wasn't sure about it, but it's actually what I use every day now. And just to change, the sphere, cylinder, axis, add, and you can see on the bottom there, we can change it by a quarter at a time, half at a time, diopter at a time, one eye at a time, both eyes at a time, any combination of what you want. And by the way, what you'll see on here, since these are screenshots from the tablet, and the upper right is what's on the chart. So I don't have to be looking at the phoropter and then looking over here at the chart. I'm just looking at my tablet. And my tablet is how I'm refracting, how I'm changing the chart, and how I know what's on the chart. So it's just one place to look, all the information literally in the palms of your hand. So really, really great. And I love the option of being able to use which interface I want to be able to use. Now, the other thing that I should really point out that's part of my, I guess, refraction or exam room suite is a slit lamp. And, you wouldn't think, well, gosh, Jeff, if you're talking about digital phoropter, why in the world would you be talking about slit lamps? Well, let me tell you why. When we first got our digital phoropter, I found out that Visionix made a slit lamp. I said, you know what? And at this time we were outfitting a new lane. I said, you know what? Why don't we just get the whole lane from you? Let's put in one of your slit lamps. Let's give it a try. And from day one, I was blown away by the slit lamp. And that may sound odd, like what's great about a slit lamp? Well, the optics are amazing. It's a really, really great LED that gives fantastic uniform illumination. Actually, let me go back to that for just a second. And so let me tell you a story. The office that I'm sitting in right now has 5 exam rooms. And in this office, we started out with one of these. And then we had one very high dollar, I won't mention the brand name, but I'll just say kind of the Cadillac or top of the line slit lamp. And then 3 other kind of mid-level ones. And I always kind of gravitated to the room with the digital phoropter and this slit lamp, where my colleagues were kind of like, well, gosh, what's in Jeff's secret room? And once they started using this slit lamp, what we actually did was we took the other 4 slit lamps in this office, moved them out, moved them to our other office, or traded them in order to have 5 of these. So we changed out all the other slit lamps in the office to be able to have the Visionix slit lamp, including the really, really high dollar, high-end slit lamp that we didn't think was certainly no better than what this is. So, an opportunity to have a really, really great quality at really good value slit lamp. It's something that I just want to make sure to tell you about, because I don't want you to overlook this as part of your exam room. So here is actually our pretest area, where we don't have to have much, because if we have the VX130 that does autorefraction, tonometry, if we want topography, pachymetry, all the other things that I told you about, that's all in one instrument. And so while the patient is sitting there having all that done, Kira, our technician, just turns to the side, puts the glasses on the lens meter, and reads it while the patient is being autorefracted. So very, very easy for the patient. Just as they move into the autorefractor, technician takes the glasses, reads them while the patient's sitting there. The patient hardly even knows that it's even being done. So this multimodal screening, getting multiple things done at once without having to move around to multiple rooms or really do anything more than to get all this information, all that Kira had to do is press 2 buttons. Basically on the autorefractor on the VX130, just press go. And with the lens meter on the VX 40, also all she had to do was set the lenses in and press go. So really with the touch of 2 buttons, gets all this done. So my staff really like this because it really makes things very, very efficient and easy. What are some of the glaucoma metrics that a VX120 or VX130 can read? So here's kind of a summary page, but it can measure tonometry, so it does NCT if you wanted to. It measures pachymetry, as you see here at different points along the cornea. It gives us compensated tonometry. So what's our tonometry once we take into consideration what the corneal thickness is? It gives us an angle measurement. It gives us white to white measurements. So all these different measurements for glaucoma. Now, as far as corneal and refractive diagnostics, so this is looking at the cornea mode. We can have a summary screen of topography. It will also uses basically a keratoconus detection index to help flag patients that have keratoconus. I actually had one just a couple weeks ago, where when I looked at it, it just stood out to me. You couldn't miss it. And then once you really start analyzing topography, you say, oh yeah, how could I miss that? Well, when you have a machine that basically tells you to look for something, you really can't miss it. So we can also have a corneal thickness map, posterior axial map. And what I'll tell you is our cornea specialist, we have a fellowship trained cornea specialist, could spend, it seems like forever, but it's probably just minutes sometimes, flipping through all the different screens of all the topographical information, especially looking at the posterior surface of the cornea when he's looking for different degenerative processes, or really analyzing somebody before he wants to do a corneal, or before he does a refractive lens exchange. So incredible volume of information that you can pull out of these instruments. It can also help you to know about cataracts. So it's looking for opacities. So looking for opacities in the lens, which obviously can pick up cataracts, secondary capsular opacities. So if someone's developing posterior capsular opacification and need a YAG. Capsular tags will show if somebody has a decentered IOL, a tilted IOL, or toric rotation, so off-axis IOL. So all these things, this instrument can pick it up. So these are all different metrics that are getting screened on every patient where you just press the one button. It's doing all of this. So one of the things I really like about this is last week I had one of my patients where, autorefraction went fine, but the technician came and told me, hey, before you do your refraction, just want to let you know, I think they have a cataract. And it's not because they looked at the slit lamp or knew what to look at, it's because they saw this opacity map. And so my technician already knew and kind of warned me, hey, don't spend too much time refracting because I don't think you're going to get very far. And it turned out to be the case. So really helpful and enabling for our opticians. So I've mentioned almost kind of interchangeably the VX130 autorefractor and the VX120. Here you just see, I guess, a listing, a chart of the different testing modalities that are available in both or any of these instruments. So just some subtle differences that we can talk about in more depth a little bit later. But I just wanted you to realize that there, as far as we'll call it autorefractor or anterior segment analyzer is really the better term. As far as that goes, there are a number of different options as far as what options do you need? What's important to you? How much information do you want and are you going to use? Because some of us might say, that's great that you can get all that information, but I don't really need it. I don't want it. Can I have kind of a more stripped down version? The answer is yes. And then some of us may say, you know what? I find value in all of that. Can I get something that has all of that in it? Yeah, you can. That you can get one of these instruments that basically does everything. So what are some of the key benefits of optimizing my practice with new technologies? So this is actually a picture of me doing a refraction, and what you'll notice is I've got my feet propped up on a drawer that's pulled out. And yeah, I actually do that. When I said it's kind of fun to do refractions and it's more relaxing and it's easier, it really is. I'll literally have the tablet in my lap and my feet propped up on a drawer sometimes. And my patient doesn't see it, so why not be relaxed? I don't think that's unprofessional. I'm still doing a great job and doing a fantastic accurate refraction. It's just easier on me to be able to do it that way. So it can sometimes almost be relaxing doing a refraction. So for sure, it's more comfortable. But with new technology, with better technology, I'm more comfortable relying on my autorefractor data and my tech refraction because I know that they have a great starting point. I use my retinoscope less, again, because of the accuracy of the autorefraction, even in kids. Refracting from a tablet is much easier and much more comfortable than doing a traditional refraction where we're always reaching up and reaching over and then reaching with this hand and doing both. And it's so much easier just to sit and click, click, click. I would tell you that I spend somewhere between a half and a third as much time doing my refractions as I do if I'm using a manual phoropter. And I really do think that they're more accurate. But I think there's times where patients just get fatigued. You can only say one or two so many times until your patient is fatigued or confused, and we start to have diminishing returns. So being able to do it more efficiently, again, more quickly, I think helps with better results. Again, to me, that's what efficiency is. And I really have less worry about mistakes by others in my office, by staff. And so because that allows me to have a greater reliance on them, knowing that this makes it easier for them. And so I can rely more on them to do more tasks. And then again, more information allows for better analysis and better decisions to be able to make. The more, what I always tell people is the more pieces of a puzzle that you have, the easier it is to tell what the puzzle is a picture of. If you have a 1,000-piece puzzle and you've only got 40 of the pieces, you don't know what it is. But once you've got all the pieces, you know what it is that you're looking at, and you know what it is that you're going to do with it. And so I like having more information right there at my finger, literally at my fingertips. What's the staff feedback? Well, staff thinks that it's really easy to use technology, and who wouldn't when it's just simple, for these two instruments, a touch of a, one button click and everything is there for you. And with refractions, it didn't take staff long to figure it out how easy it is. So they like the easy use of technology. A lot less training. Again, with the anterior segment analyzer and the lens analyzer, it's literally put your chin here, we're going to press a button, go. And for the lens analyzer, it's set the glasses here, press one button, go. And so, quite frankly, it doesn't take much training to be able to do that. And anyone in the office could perform these tests now because it's easy to be able to train them to be able to do so. It also allows for effective multitasking like you see here, like I pointed out, while the patient's being auto-refracted, their glasses are also being read, while the technician is able to still stand there in case something happens, patient has a question, which they don't, but they're right there. So able to do multiple things at one time is really, really good. I remember earlier I mentioned about patient experience. And again, what I will tell you is that patients are impressed with the technology and the setup that we have in the office. And it's amazing how often people say things like, well, I've never seen anything like this. Or, wow, it's really cool that you have, they point to or point out one of these instruments. So, from that perspective, it's been really, really helpful. Patients appreciate the efficiency. Just like we want to be more efficient with our time, our patients want us to be more efficient with their time. They don't want to be in your office any longer than they have to. And I get it. If I go to see a doctor, I don't want to be there any longer than I have to. And patients, I think, really appreciate that. And we're able to be just more efficient with our patients because of technology. And my ability to be able to spend more time just talking with patients, I think, is reflected in some of the reviews that we get. Because again, when it takes you less time to do refraction or autorefraction, or whatever the case may be, I guess one thing you could say is, well, I'm just going to do more exams. Well, the way I see it is, you know what? I'll do the same number of exams, but I'll get to spend more time with each patient, just talking, just figuring out what's important to you, and then showing them that we can provide that care. So I really think that that helps patients overall have a better experience and a greater level of satisfaction compared to when I wasn't able to utilize some of these technologies. So, you know, I've never had exceptional treatment like that, was what one of these patients said. Very personable and efficient staff. So personable, well, what that generally means is people talk to me. And when it doesn't take a whole lot to run instruments, you're able to spend more time looking at your patient, talking with your patient, giving them a more personal touch, a more personal feel to what's going on. And, you know, here's an example of a patient that noticed the efficiency. So again, the efficiency is not just for our sake, it's for the sake of our patients as well. And they do appreciate it, that, you know, they can spend less time and get just as good or better results. All right, so that's what I had prepared for you. And what I would love to do is spend as much time as you all want or need to answer any of the questions that you might have on your mind. So I would encourage you, as Adam pointed out at the beginning, to go to the questions tab, go ahead and type it in, and we can go through any of the questions that you may have. So very, very happy to be able to do that with you. So we'll wait here just a
All
second.
right. All right. So Jeff, thank you for taking us through all this. And by the way, for everyone, just so everyone knows, if you have a product question, a nice thorny product question, we have James Walker here with us as well from Luno, who can sort of help us out with the thorniest of product questions. So why don't I pull up the questions box, Jeff, and I'll ask you the questions as they come in. Question number one. So, you know, you mentioned in your own practice, you know, you have a fairly large practice, right? You have multiple lanes. How long did it take your techs to get up to speed with what was going on? And, you know, did they freak out when you actually tried to implement all this stuff, or was it a pretty smooth process?
Yeah, you know, to be honest, at first they did freak out. And so did the other doctors. We're kind of like, what, you know, what's Gerson's little toy that he's got in the corner over there? What's he making us try to use? And but really, that's the reality with any new technology. When you first see it, is you kind of question and think to yourself, oh man, is this going to be tough to do? But what I found was with the staff, once they tried it, they kind of liked it. And I don't think that so luckily these were all people that had experience on a phoropter already, so on a manual phoropter. And so it didn't take long to show them that, hey, you know what, instead of reaching, you do it here on the tablet. They picked it up pretty quickly. So, you know, I don't know how many refractions it took for them to feel comfortable, but I don't think it'd be going too far on a limb to say within the first 10 of doing it on the digital system that they were pretty comfortable doing it that way. So
Right.
in my mind, I would say it really didn't take very long to become really comfortable with it.
Right. Question here, how long after pushing the button does the anterior segment analyzer take to catch all the info?
Yeah, so the answer to that question depends on how much information you're actually having it get, because you can choose for it to do everything, or for example, we generally don't do the tonometry. We generally do Goldman tonometry, so we don't have it do that part of the sequencing. So it takes less than a minute and a half to do everything. It would take about a minute and a half if we were including the NCT. I would say it probably takes about 70 seconds maybe to do it still gets autorefraction, Ks, topography, pachymetry, all the glaucoma measurements that I showed you, except for the tonometry, all the corneal measurements, anterior and posterior surface, the keratoconus index, the in light and in dark pupil measurements and what that means for refraction, the lower order aberrations, all that stuff in about 70 seconds.
Wow. And a question here, this is an interesting one. Can you design ortho K lenses off the topography?
So it's a good question. So we're not currently doing any ortho K. So I don't know that I could answer that directly. What I can tell you is it is the topographer that we're using for fitting RGPs and sclerals. So we do that in the practice. But for ortho K lenses, I don't have an absolute answer to that. What I can tell you is again, it's the corneal measurement device that our cornea specialist chose for our practice to have instead of a pentacam. So it gives incredible information, both anterior and posterior surface of cornea.
Right. Question here, do patients notice the difference in the technology? Or I guess the real question is, do they actually comment on it to you?
Yeah, they do. They really do. Oftentimes when they first walk into the room, because sometimes I'll be the one that'll bring them into a room. When they first walk into the room, they'll say, wow, that looks kind of different. And then once we start using it, especially when we're done, they'll say, wow, that was kind of different. Or a lot of times, like, that's kind of cool. So yeah, patients absolutely notice it. Now, that being said, it's not rare, but every once in a while, people walk into a room with a manual phoropter and a slit lamp, and they'll say, wow, this stuff all looks really new and high tech. And what I want to say is, well, that thing that you go like that's the same as it's been for over 100 years. But it's a very regular occurrence with this instrument for people to remark about it. Yeah, they actually do.
Right. And you mentioned the slit lamp and the 100-year-old tech and stuff, but
Yeah.
question here, this new generation of slit lamps, does it have any photography capabilities that you can use in your office?
Yeah, so it doesn't come standard with photography, but you can actually put a digital camera, anterior segment camera into it. So like most other slit lamps, doesn't come with one, but you can integrate one into it. And
Right.
what I would tell you, one of the things that's really important for any slit lamp photography you're doing is optics. And the optics in this slit lamp are just so much better than what we used to have. It's really noticeable.
Yep. And let's see, so other questions here. You mentioned, and we got to see examples of it in the presentation. This is a tablet-driven system, a lot of it, right? So, looks sort of like to me anyway, a pretty standard tablet. It looks like it's a Samsung tablet that they're using, right?
Yep.
So I guess the question is, there we go, there it is. So the battery life is a pretty, normal tablet-like battery life that you get from this when you're using it.
Yeah, it is. And we generally either just keep it plugged in throughout the day or at least plug it in over lunch. And so then we've never had a problem with it. We haven't had to replace it. We've had it for, gosh, I don't know, 4 years maybe a little longer. And we've had no problems, needing to replace it or haven't had to do anything with the tablet. So having a tablet-driven system has worked out really fantastic so far.
Great. Here's an interesting question. So since you switched over to the new lensometer, have you changed your choice of progressive lens that you use?
Ah, no, we have not. But really, the people that it's really helpful on, and unfortunately, we all have this problem whether we want to admit it or not, is people that take a prescription and go somewhere to get cheap lenses. And what this really helps me be able to do is to show patients the difference between cheap lenses and I guess value or quality lenses, and really able to show them, see this little very thin little strip in the middle that's supposed to be your computer vision. Well, now let me show you what it's supposed to look like. And oh, okay, now I understand why the progressive lenses I got for $89 for the lenses don't work as well as the ones that were going to be more expensive in your office. So we don't use it as much for which lens we use, but showing why people shouldn't be going elsewhere and getting really cheap lenses that some other places may use.
Right. And also, speaking of the lensometer, does it check prism as well? Is that something it can do?
It does. Yep. So again, with that same one press of the button, it tells you about prism, which is a fantastic, fantastic quality.
Right. So one anxiety that a lot of people have around all of these systems, the internet sort of sits in the background of a lot of these technologies, and they worry, can I actually implement this in my office? Do I need a fast internet, or what if, God forbid, the internet goes out, right? I mean, this is everyone's daily anxiety for the past year. If the internet goes out, you're cut off from the world. What about
Yeah.
with the system?
Yeah. So if internet goes down, you can still use the system. It's fine. And we've had that happen where we didn't have internet. I can still use this. Now I can refract with it. I can auto refract. I can refract. I can do everything. But when the internet's down, our EHR is down. So then I guess it's not integrating into it because the EHR is not there to be able to integrate with. But I can still do my refraction with it. It's no problem.
Right. So basically, if people are using a cloud-based EHR, right, they should understand sort of what that means and the risks that come along with using the internet. And yeah,
Exactly. Yeah, exactly. But yeah, can still refract. I guess the one thing that would preclude you from being able to refract would be if the electricity goes out.
you have bigger problems probably if the
That's
electricity
what
went
I
out.
was going to say. Yeah, then number one, you have bigger problems. Number two, then you have no chart for them to be able to look at.
Right.
So then it really doesn't matter. So I would tell you, as long as you have electricity, then you're good to go.
Excellent. Question here, and this is an interesting one about the return on investment. So your practice in particular, right? You sound like you're the tech champion of the office, and these are you have fun actually implementing this stuff. But when you bring it up to your partners, do they start shaking their head? How did you justify it to them? And
Yeah.
how did you make it happen?
Yeah. So it's pretty easy, I think, to justify the ROI or to show ROI from a couple different perspectives. Number one, my remake percentage is just about zero. It's not zero, but it's well under. I think industry average is somewhere around 4%. I'm way under that. And I think, and my doctor remakes are, I believe for the last 3 months have been zero. And so just by that helps with the ROI. That's one thing that I would tell you. Number two, what I would tell you is the cost differential and what it is costs to be able to do this. It's not as much as what most people think. So it's not as much of a need for justification as most people imagine that there would be. So I think those would be the two main things that I would point out is a lot less error and not as much additional cost as what I think a lot of people would think.
Right. Excellent. And I completely remiss from bringing this up, the idea of integration, right? This is the entire thrust of the lecture. And you mentioned the EHR before. You happen to use a cloud-based one. Do you have
Yeah.
any sense of how that integration works?
Yeah. So, actually, I may defer this one to James, who's on from Luno. But the most important thing, if someone has a specific question, but what I can tell you from a more global picture is that it does integrate. It does integrate into most EHR systems pretty easily. And, just like you would expect from any other company or any other product, it's something that they help you with and get it integrated for you. So it's something that's relatively easy to be able to do, and again, streamline and create better efficiencies for you. But if someone had a more specific question about a specific AHR, James could probably help us to know the specifics about that.
Right. So James, are you there?
I am, yes. Just as Dr. Gerson was saying, it is relatively easy. The steps that we take to integrate that for you, it's just a matter of getting in touch with your EMR or EHR system. Once we talk with them, we know what pathways are needed, and it allows us to integrate it as quickly and easily as possible for you.
Yep. And I assume that you can integrate with most of sort of the major eye care EHRs that everyone's using right now.
Yes, sir. That's correct. We even work with the small ones too. As long as we get to speak with someone with their department, we'll know exactly what pathways we need to go to.
Excellent. Well, it looks like we are just about running out of time here, but Jeff, I wanted to ask you, did you have any sort of parting words of wisdom for everyone before we go?
Yeah, I think that what I would tell you is that so when I look at any technology, even though I generally, a champion for technologies, I'm also a very hardy skeptic. And it takes a lot to be able to get me to really jump into something. And this was really one of those things where at first I was a little slow because, if you've been refracting one way for a long time, it's tough to teach an old dog new tricks, or at least you might assume it would be. But don't let that prevent you from jumping into this, because it's something that I really think that the majority of people that try digital refraction will enjoy it, will like it better. And really, I keep using this word, but it makes you more efficient. So I would just encourage people to embrace this opportunity, check it out. And it's, you know, the other word that I've used a couple times that people might think sounds kind of corny is it's kind of fun. So it's nice to have something that's more fun than it used to be. So I would just say check it out. You may surprise yourself how much you like it.
Excellent. Well, Jeff, thank you so much for sharing all this with us tonight. And remember, everyone, if you want to get a virtual demo online, go to lunotechusa.com/efficiency. It's up on the screen right now, and they can set you up with that so you can see an even more in-depth demo of what it's all about. So, Jeff, thank you for being here. And again, this will be posted on ODwire within the next couple of days, so you can watch there. And if you have any follow-up questions, people can ask right on the site. So thanks again, everyone, and I look forward to seeing everyone online.
Thank you, Adam. Thanks everyone for attending.